Well, we are talking COVID in Connecticut. Once again, we are happy to have Dr. Syed Hussain from Trinity Health of New England to go over the latest topics based on where we are right now. This is what I am curious about, Doctor. Ever since day one, there was some uncertainty as to exactly how deadly this disease is on a case-by-case basis. And while we are clearly seeing real-world evidence that it's getting less deadly, do we know what, say, the infection fatality rate is at this point or what it was at the start of the pandemic? Meaning, what percentage of people who get the virus wind up dying?
Yeah, absolutely. Tim, that's a great question. So our fatality rate has gone down compared to where we were, say, the first surge of spring of 2020.
Yeah.
So, and there are a number of factors that we can attribute that to. First of all, we didn't know anything about the virus when we went through the first surge. There are many more therapeutics that are now available.
Yeah.
We understand the virus better. And most importantly, we have a large chunk of people vaccinated. Mm-hmm. Now, a sobering statistic I do want to share is when you compare the U.S., the number of people that died from COVID-19 as opposed to those in other developed wealthy nations, we actually lag. So we have a large number of deaths compared to other developed countries. And part of that reason is vaccination rates have also been slower in the U.S.
Yes.
There's just been more hesitancy in general.
Yeah, that's not a surprise given what we've had. Let's talk about the vaccines. It's a cat and mouse game trying to keep these new variants at bay, but they do seem to be a step ahead. That's not to say it's not a useless endeavor, but where do we stand with trying to get these new latest Omicron variants into the vaccine?
Yeah, so like you said, the virus continues to replicate and mutate to such a fast extent that, by the time we get something ready for possible deployment, we have a few subvariants. So that's what we're dealing with now. So Pfizer and Moderna have both submitted data to the FDA for approval for an Omicron-specific variant, maybe like a fall booster. But the thing is, we need to look at evidence. We need to look at data to see how it fares against some of these newer variants like BA4, BA5 that are rapidly increasing in the country.
Yeah, it looks like Pfizer thinks that it's doing a fairly good job in terms of antibody levels. Does it help at all that it looks like we're just dealing with Omicron subvariants now, or is that just sort of a nomenclature thing, just naming?
It's probably more of a nomenclature thing. It's likely still in the Omicron family because of the sequencing of the virus, how it looks like. But it is more contagious now. What really does concern me a little bit is the fact that our booster rates have lagged compared to other countries. For instance, if you look at the age group of 65 and above, it's 40% of people that are still yet to get the booster as opposed to 9% in England.
Yes.
So as this virus continues to mutate further and become more contagious and waning protection, what does that mean as we head into fall and winter remains to be seen.
Yes. Now, of course, a big focus for people is on infection and reinfection, as it's looking more and more likely that this is going to be something that's with us for a long time, something we might get once a year, even twice a year. What are our best practices now for when you do test positive?
So the best thing that you need to do is isolate. Isolate for 5 days per CDC recommendations. If you have symptoms, or even if you're asymptomatic, it's 5 days.
Yeah.
You can break your isolation and wear a well-fitted mask for the next 5 days, provided your symptoms are getting better and you're fever-free for at least 24 hours without using any fever-reducing medication.
You mentioned 5 days. I'm sorry if you just said this and I just didn't hear it. Is it 5 days from the time you test positive, 5 days from the time you first start showing symptoms?
Symptoms. Yeah, great question.
So that could help because sometimes people wait a couple of days, don't feel like that got it for you. And then don't forget the mask after that. Doctor, thank you so much for joining us again. As, there's going to be a lot to talk about, even as people are starting to move on. So thank you so much for the time.
Thank you.
Okay.